Before we go any further this morning, we have a few visitors that would want to join us and help us welcome you today. But first, we have a video from the Orange County Mayor, Teresa Jacobs. Can you please play the video?
I'm Teresa Jacobs, Orange County Mayor, and I am so proud to welcome you to Orange County and to wish you great success in this year's meeting. Sharing stories of perseverance and achievement will help inspire those around you. And for those in need of encouragement, training, or resources, there is no better forum than the Family Cafe. Caring for children with special needs and making sure that all of our children have the opportunity to learn and grow is sacred work. Thank you for sharing your knowledge with the world, and most important, with the mothers and fathers who don't know where to turn for help. May God bless your efforts today and always.
I'd like to welcome to the stage Congressman Daniel Webster and Senator Andy Gardner. Congressman Webster, you would mind welcoming the group, and thank you so much for attending.
Thank you, Lori, and great to be here. Thank you all for coming. It's just a beautiful picture of the way it ought to be. Could you imagine if this were a federal project? Probably still be stuck in the Senate after 16 years. But this is the way we ought to do it. You can come in to a cafe, to a restaurant, and order what you please. Not everybody likes broccoli. And not everybody likes everything on the menu or needs everything on the menu. But there's something for everyone. And I think this group getting together and absolutely vendoring, in a sense, all of the opportunities there are for those with disability is a beautiful picture of how local communities, not anyone else, understand what the needs are. And individual people and families and groups can get their needs met in a real way. And so thank you for Family Cafe for putting this on for 16 years. It's an awesome thing that does well for the community we serve.
Thank you, Congressman. Thank you so much. You know, this is not his first time here. So let me hear it a second time or third time here, a great round of applause. I didn't hear it. And now I'm delighted to introduce to you Senator Andy Gardner. The Senator has done a lot of work for us. He's going to tell you about his personal and his professional struggles here with individuals with disabilities, and about some of the places that he'd like to see us go. So, Senator Gardner.
Well, thank you and welcome. Thank you for the opportunity to address you very briefly. I'm not only here as a lowly state senator, but I'm also here as a dad. You see, in the eyes of the son, they say that my son has a disability. But as I like to say, my son doesn't have a disability. My son has unique ability. And it's my job. It's my job as his dad, and also my role in the legislative process, to do everything I can to help them be successful, as each of you want for your family. I want to talk about two quick things, and because I think it's important for each of you to know kind of the journey and the path that I see for us over the next couple of years. Last year, we made a change in the law that I know most of you are familiar with the IEP process. And if you know, when you go into the IEP, it's kind of a negotiation with the school district on how your child will be educated. A very simple change was done last year, where nothing can happen now unless you sign a document that you are in full agreement with the education plan for your child. talk to you about addressing the APD waiting list. That's a commitment that we've all made. We continue to draw down on that waiting list. We're going to do it again over the next couple of years. But I hope he's going to talk to you about Senate Bill 850. And let me tell you why that's important. For so long, and for too long, many students with unique abilities have been offered a special diploma. But what we've seen is a special diploma doesn't give you every opportunity that a regular diploma does. Senate Bill 850, when the governor signs it, will eliminate the special diploma. No longer will our children be put on a different path. Our children will be given the opportunity for a regular diploma and given every opportunity to get a real job and a real education. The second piece of that puzzle in that bill, if you're familiar with the McKay Scholarship, it gives you the opportunity to pay for tuition in the private school that may be in the best interest for your child. In this particular bill, there is money set aside for you as a parent that gives you the opportunity to pay for additional therapies, speech therapies. You're empowered to make the decision. And the monies that you don't use, those monies are rolled over in an account, and they're built up so that when your child gets to the point where it's time to go to vocational or to secondary, you have the ability to pay for those opportunities. It is a sea change on how we educate our children. But you see, as each of you here, I go at this not as a senator, but I go at it as a dad. And I want every opportunity for my son with unique abilities to have a job, to live independently. And that's going to be my goal, and it has been my goal. And I've got 2 years left in the Florida Senate, and I hope that you'll see more. We're a partner with you. We're walking the walk. So thank you for being here. And thank you for everything that you do for this great state. Welcome. Thank you.
Thank you, Senator. Thank you so much. Also, Representative Jason Browder is in the audience. I'm sorry. If anybody knows me, sir, if there's a last name to mess up, I will do it. So I apologize to everyone when I can't remember names, and I will also mispronounce everyone's last name. So I'm sorry. Sir, would you like to come up?
Thank you very much. My name is Jason Broder. I'm in the Florida House of Representatives, and I didn't need to say a couple of words, but I'm feeling inspired by Senator Gardner. I was his partner on the Individual Education Plan bill in the House of Representatives, and that was really my first exposure to the inequities that are sometimes found when our families are trying to get public education. There is often an adversarial process that doesn't need to be. It should be collaborative. It should be something that which works for the family and the school. And that bill really makes a step forward in that. In the future, going forward in these last 2 years that Senator Gardner has, I hope to be able to partner with him on a bunch of more initiatives that will help families continue to be a collaborative process to get the public education that the families need, and to be able to go and live independently, to have jobs just like everyone else. And so we're very fortunate as a state to have Senator Gardner, because he does approach this as a dad. And I think that's exactly what's needed sometimes in the legislative process, is to step back and say, how is this going to affect my family? And he does that, and I'm certainly willing to follow his lead over the next several years to make sure we have great legislation coming out like the IEP process. So thank you for having me, and if you have any questions, please feel free to ask.
While they're still here on stage, I'm going to tell you all, some of you who have been here over the years know that we here at Family Cafe have a tradition. And I'd like to tell you a little bit about this tradition, and then I'd like to make some remarks about the tradition and honor these three gentlemen for participating in the tradition. It's called The Story of the Rose. You know you've done something good when roses came to your door. Let me sort of share the story with you. How many of you there here know who Justin Dart is? I want to tell the rest of you who Justin Dart is. Justin Dart Jr. was one of the greatest leaders of the international disability rights movement and a renowned human rights activist. He's recognized as the father of the American with Disabilities Act and the godfather of the disability rights movement. Through the end of his life, you see, because Justin Dart's no longer with us, he remained dedicated to his vision of a revolution of empowerment. When Justin Dart knew that someone had accomplished a great feat or had done a good job, he sent them roses to let them know how much he appreciated them and needed them to lead on. You knew you did good when roses arrived. I like tradition, and I thought this was an awesome tradition. So I asked for his families and friends if the Family Cafe could carry forward this tradition after his passing. We too wanted to recognize good work and honor Justin Dart's commitment to people with disabilities by presenting roses to the people that make the difference to both, and to thank them and encourage them, and ask them to carry on to lead us on. So today, we'd like to say thank you for the good job these three gentlemen, which I need to turn around, but okay, and thank you for caring. In the words of Justin, there is nothing I have accomplished without reaching out to empower others. As appreciation for what you've done for a truly good job, we present you these roses. I cry out to you from the depths of my being. Humanity needs you. Lead, lead, lead. The revolution of empowerment. That's a quote from Justin Dart. So. She says her name reminds, just say, don't say, I asked her how to enunciate her name because I was so afraid I was going to screw it up. So guilty. So she said it rhymes with Sarah. So as soon as I thought, Sarah's in my head. So, and this one says you just call her Sarah. So Sarah, thank you.
Yes. Welcome. Families and community and educators, it's just so thrilling to have you all here once again, celebrating the Sweet 16. Again, my name is Monica Torado, and I'm the Bureau Chief of the Bureau of Exceptional Education and Student Services. And it's thrilling to know that there are more than 6,000 participants over this weekend. And we expect to have thousands more who will come, who have not even registered yet. I would like to give a special thanks to all the dedicated Family Cafe staff, the planning committee, and volunteers and sponsors for making this incredible event happen each year. Let's give them a round of applause. On behalf of the Florida Department of Education, we are proud to partner with the Family you will learn more about our statewide resources through exhibition booths and session presenters. And there is just a jam-packed couple of days here. The sessions are just incredible. And what's especially important is that the issues are real and relevant. The kinds of things that maybe you wonder, can we talk about this in a public forum? Yes, you can, and they're on the agenda. And I think that's what's really important, is that you're going to get information that's helpful for you. This year in the Department of Education, specifically with exceptional student education, our focus is on parent engagement, and specifically two components: making sure that we focus on parent voice and choice. We talk a lot about that with our students, right? That they need to have voice and choice. But parents also need to have voice and choice. And so one way that you can make sure that your voice is heard is through participating in our state-sponsored annual family survey. This is something that the state puts out every single year. Most likely you would have heard about it if you have a child in the pre-K through 12th grade through 22-year-old system through the school district or your school's principal. And I'm hoping everybody here has heard about it. If you did not hear about it, then let me know so I can follow up with your local school district. So the survey has run from about January. It's now closed. But we have a special opportunity to capture out of the 6,000 participants who are here this weekend, those who have not yet participated. We have polling, computer set up for polling right out here in the hallway. And we are hoping that you will take just a few minutes of your time and go ahead and tell us what it is that you need, what's working, what's not working, and provide those comments. It's completely anonymous. It's in multiple languages. And my goal, my hope, is that we will increase our participation by several thousand this weekend. So please make sure your voices are heard. And up till now, we have over 20,000 parents who have responded across the state. What's really important to know is that district goes back to your school district, and it also goes back, it can go down to the school level. And in it, the questions can be disaggregated. So things like, I feel like a partner in my IEP team. I was made aware of my rights. Those are the kinds of questions that are in that survey. And districts are charged with using that data to help define their district improvement plans, and then local principals to work with parents at that local, most intimate level, which is that IEP team, to be sure that we're meeting their needs. So again, if you have not completed that, please do so. Tomorrow, during my session, we're going to talk more about our goals and ways that we can continue to outreach to parents to be sure that your voice is heard and that you know about your choices. And Senator Gardner did mention several of them that are new, some from last year and some from the most recent legislation, that we'll have an opportunity to talk about and make sure that you understand your rights and what choices are available for you in Florida. Thank you again for being part of this wonderful event, and thank you from the bottom of my heart for everything you do each and every day for your children and those of you who are caretakers, for those that you take care of, and just making this our society much more wonderful, rich, and diverse. Thank you.
At this time, I would like to introduce the Board of Directors for the Family Cafe. If you're in here, can you please wave your arm, wave your hand? Oh, they all are there. Anybody else in the room that? Okay. Thank you for all you do for the Family Cafe. And if you need anything over the weekend, you can come and find someone in a white coat, and they will help you out with whatever you need. One board member just came in. Jeannie, wave your hand. She's our newest board member. I even need help with this. I want to back up a minute. We were going to do this from behind the little counter here, but unfortunately you couldn't see me. So that's why we moved it out here. But we really wanted to go back there and kind of show off what we got. I would like to introduce you to our state's Surgeon General, Dr. Armstrong. Dr. Armstrong is dedicated to making Florida the healthiest state
in our nation. Please join me in welcoming Dr. Armstrong.
Good afternoon, everybody. I am delighted to be here with you to celebrate Family Cafe's Sweet 16. Last year, I attended my first Family Cafe. And I'll tell you, I was impressed. I was impressed by how the Family Cafe and partners work tirelessly to provide Florida's families and caregivers with resources and guidance to support the health and well-being of our state's children, adults, and families with special needs. I am delighted to follow the elected leaders who were just on this stage. You will not find a more dedicated group of individuals for inclusiveness and for ensuring opportunity for all Floridians. And in many respects, I'm the advance party for our governor. Governor Rick Scott is a passionate advocate for the health of all. And I know you look forward to welcoming him tomorrow morning. Thanks to collaborations around our state, this Family Cafe has helped over 100,000 Floridians through education, training, and networking. And as I look, as I look out on this room this afternoon, I see so many wonderful faces. For our future together, your Department of Health is focused on partnerships with health organizations statewide so that you have what you need to succeed. And those partnerships begin with our other state agencies. Take a look on the side here. This event is sponsored by, and you see a variety of state agencies listed. And I want to do a shout out to Barbara Palmer, Director of the Agency for Persons with Disability, and Mike Carroll, Interim Secretary of the Department of Children and Families, and Liz Dudek, Secretary of the Agency for Healthcare Administration, and Chuck Corley, who is the Secretary of Elder Affairs. We meet regularly to figure out how we can do things better with all Floridians. Not to all Floridians. There is a difference. Some other names I want to share with you because we're thinking differently about health in our state. Pam Stewart, Commissioner of Education. Herschel Vineyard, Secretary of Environmental Protection. And Anand Prasad, Secretary of Transportation. We are looking at a whole host of settings and environments where we can influence health outcomes and think differently about how we can move health forward in the great state of Florida. You know, in essence, we're striving to create a one-stop shop so that Florida's families can navigate more readily the network of services and opportunities available to individuals with special needs. Now, among many ways that your Department of Health is serving Florida's children, adults, and families with special needs, I want to highlight two. And these in particular relate to our Division of Children's Medical Services. We work to assist Florida's families from the very beginning. We have early steps. How many are familiar with early steps? Yes. You know, we offer services for infants and save another happy customer. We offer services to infants and toddlers with delays or conditions that may result in delays. And what we're trying to do is to help each child reach his or her potential for development and full participation in communities. Early Steps also provides a foundation that supports families and caregivers in developing the confidence to help their children learn and develop. I'm also delighted to announce this afternoon the rollout of our Children's Medical Services Network Specialty Plan on August 1st, which is a transition into Medicaid managed care. This network provides families with a broad range of clinical, developmental, and support services for children with special health care needs. And let me ask for a show of hands. How many families are in the Children's Medical Services Network now? I am delighted to see your hands. I hope at next year's Family Cafe I see even more hands. And I want you to know that we are committed in this transition to seamlessness so that you will not notice any gap in any services. See, these services, they help your child grow up healthier. They include prevention and intervention, along with primary, specialty, and long-term care. But you know, for these to be great services, they need to be available. And that's why we place a particular premium on offering care coordination to help guide families through the system of services that are available. I think you can see that your Department of Health takes its mission very seriously. We work each and every day to protect, promote, and improve the health of all people in Florida. And as we continue to work toward this mission, we are reflecting on our traditions of success from the past. You see, this year we're celebrating 125 years of public health. We were founded in 1889. And since that time, the department has worked to reshape environments that put public health to action in communities across our state and, importantly, make Florida more accessible for our residents and visitors with disabilities. You know, Floridians are not defined by disabilities. Floridians are defined by abilities and opportunities. And that is part of the rich tradition of your Department of Health. Over the past 125 years, we've grown from a state with 270,000 people to a state with 19.6 million, and on any given day, 1.8 million visitors. The Sunshine State is now the third most populous state in the nation, and we are the premier vacation destination in the world. And although many early settlers to Florida found our great state uninhabitable, thanks to public health efforts in communities through disease control and improved environmental health, Florida has been open for opportunity to everyone. You here today are similar to those pioneers who opened Florida to possibilities through improved health. You are making a difference for all of us. You motivate all of us to move health forward in Florida. And I want to pause to acknowledge one of our state's great pioneers, Lori Fahey. Lori, thank you. We get inspiration everywhere we go across the state of Florida. And the inspiration that keeps health moving forward for all is behind our efforts to address the top public health threat to our future, which is the challenge of weight. That is a challenge for everyone. Currently, only 36% of Floridians are at healthy weight. 1/4 are obese and the rest are overweight. And on our current trend, by 2030, 6 out of 10 babies born today will be obese or overweight before graduating from high school. This is not the future that we want for our children, adults, families, communities, and entire state. We know that weight-challenged individuals live sicker and die younger, and that the livelihoods of Florida's families are threatened. And importantly, we cannot afford the medical costs alone for managing weight challenge. Just 4 diseases related to obesity, high blood pressure, arthritis, heart disease, and diabetes, just those 4 will cost $34 billion through 2030. Do you realize that's half a state budget? Think about other ways that we could use those funds to greater advantage for people in Florida. So in response, your Department of Health has launched Healthiest Weight Florida. This is a public-private partnership that is bringing together businesses, other state agencies, schools, not-for-profit organizations, faith-based groups, and entire communities to help inform Florida's kids, adults, and families about what they eat and how they need to be active in life. We recognize that tackling the challenge of weight needs to be a team sport. And we are encouraging Florida's families to work together to adopt healthy habits and maintain healthy homes. Weight challenge is the sum of seemingly small choices over time, where we take in more than we're active. And what happens to the human condition? We expand. So the solution then is to reverse that flow of calories and to be more active so that we each achieve a balanced, healthy weight that lasts. 3 things that you can do today to move to healthy weight and stay at healthy weight are: 1, substitute water for sugary beverages, carbonated or otherwise. I'm not saying eliminate all carbonated sugary beverages, but start to take that down with water. Substitute fresh and Florida fruits and vegetables for processed foods, processed cereals. We're blessed to live in a state that has extraordinary agriculture, and in season, it is cost effective. It is not expensive. And the third is, be more active in daily life. And I saw earlier a wonderful example of activity. In fact, you all were making more beautiful music just moving than the voice of Pharrell. And that's what we're talking about. So I would urge you to engage your family in activities such as Sportsability, which is an exciting event focused on enhancing the lives of people with disabilities by promoting active living. Look to the example of the Florida Disabled Outdoors Association with their recent partnership with Goodwill Industries of the Big Bend to provide fitness and wellness activities for people with disabilities. And to help Florida's families experience the health benefits from getting outdoors, your Department of Health, in partnership with the Florida Park Service, as well as Get Outdoors Florida, recently launched the Nature Play Prescription Pilot Project. In this program, your department in 44 counties is providing 10,000 Nature Play prescriptions for at-risk children. Each prescription is a free day pass to a Florida state park, and it includes up to 8 people per vehicle. What do I hear in that? Family. And I encourage all of you to visit one of our state's beautiful parks. And you're going to recognize that the Park Service is committed to ensuring that its facilities, programs, and services are accessible to and usable by all people, period. I would ask that you visit the Healthiest Weight Florida website, which is healthiestweightfl.com, healthiestweightfl.com, to find more resources about building healthy choices into everyday living. Some of these resources include meal plans and fun activities to make a healthy weight a reality for everyone in our state. Now, some wonder, can you really achieve success with such a daunting challenge as weight? And I'm here to say, in the great state of Florida, where we sent a person to the moon and saw that person and team come back safely to Earth, the answer is yes. In fact, already, with our Healthiest Weight Florida initiative, we have gone from number 19 to number 12 as healthiest weight state in the nation, and we intend to be number 1. We are going to beat Colorado. And we have also seen an increase of 1.5% in healthy weight Florida adults. Now, what does that mean? That's 225,000 adult Floridians who now are at healthy weight relative to where they were only 18 months ago. That's the size of Alachua County, the home of the Florida Gators. So we clearly have some Gator fans. You know, I tend to be very ecumenical. I actually married a Seminole. I was on faculty at the University of Miami, University of Florida, and University of South Florida. So I always say, particularly in the fall, go great games for Florida teams. But as we look at other areas of improvement for healthy weight, I just want to share 3 high school behaviors that are encouraging. We have seen a drop in soda consumption and screen time, TV time, and an increase in physical activity. So your involvement in Healthiest Weight Florida will make a profound difference in your own lives, the lives of your families, and the lifeblood of your communities. We are on this journey to achieve healthy weight together. We want lives fulfilled. And ultimately, healthy weight is very personal. It's about more birthdays, more graduations, and more anniversaries. And in the process, Florida will remain the best place to live, work, and play. Well, this Sweet 16 Family Cafe is a gem. It is filled with many family activities, including active recreation and opportunities for healthy eating. And I urge you to take advantage of all of it, and especially the community that exists here, because it's through community that we find solutions that stick. Please take advantage of the exhibits and the sessions. I was pleased to walk through the exhibits earlier today, and the energy is extraordinary. This is about coming together so that we make Florida the best state for everyone. I want to thank you again for inviting me here this afternoon. What an honor it is for me to be with you at my second Family Cafe, and I am going to anticipate seeing you again at my third Family Cafe